We begin with a new plan to roll out more COVID-19 vaccines. Doses of the vaccine will soon be available in retail pharmacies nationwide.
Starting on February 11th, the federal government will deliver vaccines directly to select pharmacies across the country. This will provide more sites for people to get vaccinated in their communities, and it's an important component to delivering vaccines equitably.
The White House announced plans to ship nearly 1 million doses to about 6,500 pharmacies per week. Officials say they plan to increase that number once more supplies are available. They also announced an increase in doses being sent to states. Instead of 10 million weekly doses, they will receive 10.5 million. Meanwhile, the number of people hospitalized in the U.S. has finally dipped below 95,000, a number we haven't seen since November. But despite falling numbers, conditions in many hospitals remain heartbreaking. CBS News national correspondent David Begnaud takes us inside one California hospital, helping its frontline staff deal with the constant suffering.
Captain Joe Hargrave has been at Riverside University Health System for more than 3 weeks now. This Army nurse is on his third COVID deployment inside the United States.
Where are you from?
On this day, 2 of the 5 patients he was caring for took a very sudden turn for the worse.
How was today? Tell me.
Today was a day. You just see them come in, they're alert, they're oriented, they're talking to you, and then just to see them decline in such a rapid rate, that was hard for me because every time you go into the room, you just kind of have to be like, okay, focus on me. Don't worry about the monitor. You're doing well. You're doing good.
Hargrave is haunted by what the virus is doing not just to the patients, but to the families too. Their only news about their loved one often comes over the phone. And in many cases, it's Hargrave that's connecting them. And when that person is nearing the end, only 2 family members can come in and say goodbye.
Today, a wife had 3 children, and it's like, who do you choose to come with you to say goodbye to your father? If it was my father and my mom had to make the decision about who would go with her to say goodbye, I just can't imagine that.
This virus is taking an immense toll on all of the healthcare workers like Hargrave, according to psychiatrist Matthew Chang.
The trauma is not just an acute one-time trauma, but it's over and over again.
So to help them process this trauma, the hospital has peer support specialists who spend time with critical care staff in meetings and on the floor of the ICU.
I'm always grateful for them.
According to critical care director nurse Tammy Lowe, even though the medical staff may have gotten better at treating COVID, dealing with it is still tough.
I know that there are staff members that have nightmares of stacking bodies, nightmares of so many patients that they can't keep up with the tasks. We're in there trying to offer them any support that we can.
David Begnaud, CBS News, Moreno Valley, California.
And joining us now is Dr. Robert Glatter. He is an emergency room physician with Lenox Hill Hospital in New York. Dr. Glatter, welcome. Thank you for joining us. Tell us what you are seeing at your hospital and how are colleagues dealing with the daily trauma of treating patients, some of whom they know are not going to survive.
Well, we're continuing to see cases, Tanya. This is an ongoing situation. And, certainly much has been written about, how the pandemic has played out amongst younger patients, specifically those 20 to up to 49 spreading it. But we're still seeing a large population of older patients in their 50s and beyond who are testing positive and going on to have moderate to severe disease. Less innovations than we had back in March, but we're still seeing, a fair amount of progressive disease, and it's heartbreaking. We're trying to impress upon the public, obviously with some fatigue at this point throughout the pandemic, to wear masks, continue distancing. But it's the variants that certainly have people concerned about what's going on, and there's no question about that.
So a new study shows the COVID variant, first identified in the UK, has evolved to show resistance to vaccines. This comes as Dr. Anthony Fauci says when this variant becomes the dominant strain in the U.S., people who have already had the virus could become sick again. I guess we knew to some extent that that was possible, but how concerned should people be, and how much protection can antibodies or the vaccine realistically give us against these emerging variants?
You know, the bottom line is that we have to have a healthy respect for these variants. They're out there for sure, we know that. But we know that vaccination is the key way to prevent their progression. And we can't impress upon the public so much to say that vaccination is so important at this point. This is how we prevent spread. Viruses need to replicate, and when they replicate, they can mutate. So if we break the chain of transmission by effective vaccination, this is really what we can do. We also have, obviously, the ability to wear masks and distance, but it's vaccination that's so key, and certainly frustrating, obviously, with the rollout as it's been, and just trying to get people vaccinated. So that's certainly a concern by and in of itself.
And doctor, isn't there some evidence pointing to these variants perhaps having a higher mortality rate? Why is that? And is this a matter of a higher infection rate just manifesting itself into greater number of deaths, or is the strain itself proving to be somewhat more aggressive?
Well, the strain itself is actually more aggressive. The 117 variant in the UK produces a higher viral load, and therefore it leads to higher complication rates. We're talking about pneumonia and then potentially innovations in respiratory failure, but also systemic disease that affects the kidneys, may lead to even diabetes or even strokes. So we know that the viral load is the problem with this variant. And so again, you know, vaccinations are the key to really protecting against this. There is the possibility that we may have to revise the vaccines later on down the line, but I want to just reiterate that when the vaccine becomes available, it's important to get it now, and people should not wait for any potential change in the vaccine. That is very, very important for people to realize.
Absolutely. I think in most places the desire to get the vaccine is great. It's just the lack of the vaccine is still the problem. Doctor, as more of these variants are popping up in the U.S., that's happening at the same time as the country is seeing its overall numbers decline. So what are the major concerns about that? Do we need to get ahead of the variants to stay on this downward trend?
Well, again, vaccination is the way to get ahead, but we're concerned because there could be a surge in the next 6 to 8 weeks. Many of the scientists, looking at what's going on, especially through genomic surveillance, looking at the kinds of variants, are concerned that we could have a surge just from the variants alone. And so getting ahead of this, is problematic. But again, to reiterate, vaccination, as best as we can, is to be our best weapon against this. And obviously, small groups, keeping our distance, wearing masks. And with the Super Bowl coming, we got to be very careful to remain within our household or our pods and not really invite outsiders in. That is a primary way that we could spread the virus and have a super spreader event. So it's very key to understand.
Absolutely. I think a lot of people become comfortable in a zone of friend groups, which is slightly beyond their family pod, let's say. And right. That's really dangerous, don't you think? Because it's one weak link in that friend group and the fortress is breached. Exactly. It's that person who, feels well and is asymptomatic, because that's primarily how spread occurs, is amongst that group. And then, you eat together and then suddenly, 5 to 7 days later, you're feeling symptoms. So again, it's so impressive and important that you stay within your pod, within your social circle, and don't expand it, especially in light of special events like the Super Bowl or any kind of family events. Very, very good advice. Dr. Robert Glatter, thank you so much for joining us.
My pleasure.